Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the Ansa cervicalis. The Ansa cervicalis is a loop of nerve and it is a part of the cervical plexus. It innervates the infrahyoid muscles. Ansa cervicalis is embedded on the anterior wall of the carotid sheath over the lower part of the larynx. How it is formed? It is formed by a superior root and an inferior root. The superior root is derived from the first cervical spinal nerve and passes along with the descending branch of the hypoglossal nerve. Hypoglossal nerve is acting as a conduit. The first cervical spinal nerve and the hypoglossal nerve fiber does not mingle. They come together by a fibrous band like structure, so we'll get together the descending branch of the hypoglossal nerve and the first cervical spinal nerve. Then the first cervical spinal nerve split from the hypoglossal nerve. The superior root of the Ansa cervicalis is also called descendens hypoglossy. The inferior root is derived from the second and third cervical spinal nerve. It is called nervus descendens cervicalis. We have to remember that this is not always constant. There is some variation. Okay, so we got that. Now we look at the picture here, the image of the Ansa cervicalis. This is taken from Gray's Atlas of Anatomy, 3rd edition. The Ansa cervicalis inferior root. This is the inferior root of the Ansa cervicalis. This is the inferior root. This is also called descending cervical nerve or nervus descendens cervicalis. Passes over the internal jugular vein. This is the internal jugular vein, okay, and joins the superior root over the internal carotid artery. This is the internal carotid artery. They join together to form a loop, and this loop is the Ansa cervicalis. Ansa means loop, okay. So the superior root innervates the superior belly of the omohyoid. This is the omohyoid superior belly, omohyoid inferior belly. Superior belly is innervated by the superior root. This is the superior root innervating the superior belly of the omohyoid. From the inferior belly or just close to the loop area, we are getting innervation to the inferior belly of the omohyoid. Okay, we got that. The loop of the Ansa cervicalis innervates the sternothyroid. What is sternothyroid? From sternum to the thyroid. Sternothyroid. What is the nerve supply? From the Ansa cervicalis. Then what? Sternohyoid. From sternum to the hyoid. This is the hyoid bone. From sternum to the hyoid. This is the sternohyoid muscle. Innervated by what? Innervated by the sternohyoid muscle. It is getting innervation by the Ansa cervicalis. Okay, maybe it is getting contribution from also the superior root of the Ansa cervicalis. Okay, then the inferior belly of the omohyoid by the inferior root of the Ansa cervicalis, or just from the loop of the Ansa cervicalis. But we have to remember that the thyroid gets innervation from thyroid to the hyoid muscle. This is the thyrohyoid muscle. It does not get innervation from the Ansa cervicalis loop. it is getting innervation directly from C1. And we are saying the superior root coming together with the hypoglossal nerve, then superior root will split from the hypoglossal nerve, innervates the thyroid muscle. Okay, but this thyroid muscle innervation is not from the loop, not from the ansa cervicalis. It is from C1. Okay, the loop is here. Loop is here, and this is the C1 still going through that to innervate this muscle. So loop is here, going to loop, splitting here, but a lot of fiber of C1 going to supply the thyroid muscle. So thyroid is getting innervation from C1. Also the genuhyoid muscle, another muscle not shown here, this is also getting innervation from the C1. Okay, the genuhyoid muscle. So we got the muscles innervated by the ansa cervicalis. Ansa cervicalis is a loop of nerve. And that's all about the ansa cervicalis. If you have any question, please feel free to ask me. Please support my channel, please subscribe me and share the information with your friends. Have a nice, wonderful and blessed day. Bye now.